An Alberta Health Services program has improved access to primary care for local seniors and eased pressures on the city's emergency departments since launching 1 year ago. Referrals are made by family physicians, specialty clinics, and caregivers primarily for seniors living in supported living facilities, community lodges, or living at home.
Over the 1,500 patient events we've done in the first year, it clearly is indicated that we are making a difference. The patients that we see by and large are staying at home and receiving the appropriate care and have no need of care in the emergency department.
Glad Burry was referred to the program by the Complex Chronic Disease Management Clinic at the Peter Lougheed Centre after she was discharged from hospital earlier this year.
I was in hospital with pneumonia, and I was sent home and was not very well at all. And they came one day, and oh my goodness, it was such a help. I knew that I couldn't go out to a lab to have the blood work done, and I couldn't. I was just too sick. So they were there, and they took my blood. They did everything that the hospital could have done and more. And they encouraged me, and that was one of the big things.
You know, often people are sick, and it's ironic, but they're not well enough to go get medical treatment. So having the paramedics come to the home not only saves them, you know, having to go out in, you know, inclement weather or just sort of exacerbating the, you know, the symptoms. You know, just the stress of having to go out is great. So, you know, that alleviates a lot of those concerns. They you know, they can stay in their home and have medical care come to them. I think it's awesome. It's a really great program.
It's been a great experience. We've as paramedics, it's recognized what we can bring to the healthcare system. We do really great comprehensive assessments. We have diagnostics that are in our toolkit, and we have interventions that we can provide. And now we're given the time to spend with the patient to deliver those appropriately.
In addition to their past training and experience, these specialized paramedics undergo 6 additional weeks of classroom training, followed by a 4-week practicum with nurse practitioners in supportive living facilities. Treatments provided by community paramedics include electrocardiograms, vital sign monitoring, blood collection, administering oral and IV medication, providing wound care, and focused assessments, all under the medical direction of a physician.
Well, our mission is to make sure that everyone has access to primary care and specialty care. Often patients are sick. They're not sick enough where they need an ambulance, where their complaints could be managed by their family doctor or their specialty physician. And often they can't, because they're ill or because of their chronic conditions or a lack of support, they can't make it to the clinic itself. And we bring that clinic care or that family physician care to the patient's home.
I think that all in all, they really helped me to recover.